Dr. Ravi Kerur will be speaking on Neuro-Linguistic Program in Pain Management.
Good afternoon, everyone. At the outset, I would like to thank organizers for giving me this opportunity. Myself, Dr. Ravi Kerur from JNMC Belgavi. Okay, this is quite new topic. Subject itself, it is Neuro-Linguistic Programming in Pain Management. So I'll be discussing some introductions, foundations for neuro-linguistic programming, mechanisms and evidence, comparative analysis, integration and applications, and future directions. What is NLP? NLP is a study of structure of subjective experience which can be calculated from it. It is started by in 1973 by Richard Bandler and Grindler, who was a student. So what do you mean by neuro-linguistic programming? Neuro means the nerve communication, which is nothing but a structure of our brain. Programming is the operating instruction that create an outcome. One more is linguistic, the language what we use or the words what we use. It is called linguistic. Then comes the programming, which is the operating instruction that create the outcome. So I'll make it very simple. How many of you are feeling cold here, or hot, or comfortable? All are comfortable? Some may be feeling cold, some may be feeling hot, some may be. So is it the set temperature or it is the subjective experience? It is a subjective experience. All the other rooms are studying about only the AC temperature, not the subjective experience. For example, whenever there is an external event, suppose, external event, for example, set temperature. Suppose set temperature of this room is 22 degrees Celsius. It filters through many things. Whether you are coming from North India, whether you are coming from South India, what kind of dress you are wearing, whether you are male or female, what do you feel, are you nervous? The many factors affect the temperature what you are feeling. For same thing, whenever there is external event, so there are meta programs, values, beliefs, decisions, memories, which will affect the external event that goes into the brain. Once it goes into the brain, again there is internal representation of the brain and the state of the mind and also physiology and the behavior pattern that leads to a subjective experience of the pain. Unfortunately, we are worried about only the physiology part or the external event. That's all. So this is, everyone knows the common pathway of pain. This is from the pain receptors to the brain. So this is a perception at the end what we feel it. This is the subjective experience. Can we do anything here itself, the subjective experience of the patient? So core NLP principles. These are the set of skills which can be used for our day-to-day life. It is a core NLP principles are pain is a subjective experience modeling, something called anchoring, which will come to. Reframing is the subjective experience can be changed or not. That is reframing. Rapid transformation, which can occur while you're talking to patient itself. So pain is a negative thoughts. Stress and amplification lead to more pain. NLP intervention and pre-structural thoughts, and then comes to improvement. Okay, so I'll skip this. Okay, why this NLP technique? Do we have the cognitive behavioral therapy? Why this NLP technique? The focus level here is it's an unconscious rapid reprogramming. It's an unconscious level rapid reprogramming. Unlike CBT where they use conscious gradual restructuring. We are sitting at the OPD, we have 10 to 15 minutes time, and in that 10 to 15 minutes of time, we have to assess the patient, find it. Although we are doctors, we know that within 10-15 we'll come to know this is a bit of subjective, there is an effect of subjective experience of the pain. Can we do something in 10-15 minutes to do that patient? Primary techniques are anchoring, reframing, modeling. Applications in coaching, usually NLP is used in coaching, personal development. Wherever CBT it is used for clinical therapy and it needs a special expertise. the NLP most important is the speed of change. It is rapid in minutes. You can change the subjective experience in only few minutes. It has got empirical support, clinically can be used. While the CBT is other way. Coming to NLP techniques of pain management, I'll tell some of the few of the techniques which I have used in my clinical practice because it is relatively new in pain management. I learned some NLP for my self-development. I utilize those techniques to clinical improvement. First comes mirroring technique. This is a new technique. For example, a child is there, 3-year kid. So how do you speak? We bend down, we speak, how are you baby? What's your name? Like that. Do we speak, my name is Dr. Ravi, what's your good name? He never speak to you back. Why? Because predominantly the child, 3-year kid is mainly speaks in subconscious mind or the original mind. So what happens when patient comes to you, the way you speak to them makes a big difference. Like suppose patient is nervous, if you're speaking confidently, the subconscious mind feels that he is confident, he is not my kind. Okay, you start speaking in this nervous tone only. For example, you have to match the patient. Like as I told you, I spoke in the child's language, I bent down, I use the tone of the baby, I use the words of babies, I tone, words, sound, even like you can offer the chocolate, all those things are matching to the baby. Same thing when patient comes to you, you can match the patient's, what all things we can match? Match the posture. If patient is sitting like this, you can sit like that. If patient is sitting like that, even you can sit like that. That subconsciously affects the patient's mind. So here you note down, we are connecting to the subconscious mind, not the conscious mind. Match the posture, gestures and facial expressions. Speech patterns, align the tone. If patient is talking in nervous tone, you can speak nervous tone. Patient is talking confident, you can speak confident. This is an awareness you have to develop. Choice of words, like suppose patient is telling burning type of, it is burning type of pain. The more the word the same, the words you use the same by the patient connection happens subconsciously. Then the trust develops subconsciously, and whatever treatment you do, it will be affecting. Pacing, learning. First mirror the behaviors to establish the rapport, then gently guide the interactions. Then comes reframing. So you might have seen child suddenly shift of subjective experience child. Suppose a child is going here, suddenly it hits a table. Suddenly what mother does, oh, hit the table. Oh, this is hit by you? Okay, hit the table. Then suddenly the child stops crying. Even it beats the table and it becomes happy. Why? Because sudden shift of subjective experience happens to the child. Same thing can be utilized in the pain management. You can reframe the patient side. For suppose patient is telling, I have a low back pain, so I am suffering since morning to evening. And if you ask them, really are you suffering from morning to evening, 24 hours? No, she will say 24, only in the morning. Are you in the upper back, lower back? No, only in the lower back. Then are you in the left side, right side? It can be only one part of the back she is suffering from, but she generalized to the back. So by asking it questionably and telling her that that is you are suffering only this part, only in the morning, that too in only 1 hour. So sudden shift can occur. So she is suffering for only 1 hour in the morning, but she represents it as if she is suffering whole day and whole life itself. So by questioning and reframing itself can improve the pain pattern. Then complete visualization and guided imagination. So you can train the patient within 10 minutes. It can be done within 5 to 10 minutes. You can make the visualization of the patient. Suppose I was sitting there, I was a bit nervous to come here down dais and talk, and I was imagining myself that, okay, I'm talking confidently, I'm delivering lectures, all are happy, all are listening. So that is an imagination which I'm creating to my brain, and that is practiced as soon as I came here. So same thing, patient can be imagined, we can teach the techniques, few techniques to imagine themselves as a pain-free, confident, happy, because all the pain patterns are connected to the fearfulness, stress, anxiety, all those things. Patient imagine a soothing environment, or they can calm down, can be connected to the music or anything. Visualization, which I told you. So as soon as you see this, for example, I say, Bolo Bharat Mata Ki, what happened? So there is sudden surge of some emotions in you as soon as you see this picture. The picture has nothing to do with you, but as soon as you see, there is a connection already which has been formed. So can we create new connection in your brain? Like suppose pain means always there is a connection to the something like fear, stress, anxiety. So when we recreate this, like pain means okay, something manageable. Pain means some doctor is always. So pain means we can take a support. So always there is a connection of pain with the fearfulness or the helplessness. So see, we can see that only by seeing a picture, there is a change of emotions, neurotransmitters changed, you got sudden surge of adrenaline, everything. So this is 10 rupees Vimal. Okay, see how the NLP is being used by in the advertising department also, advertising companies. So this is less than 10 rupees Vimal tobacco. Okay. But what they do is they connect the 10 rupees to these heroes like Salma, so Shah Rukh Khan, Ajay Devgan, all these people. When the value of the Vimal goes up, you feel great. So this is, I'm just giving an example. They are connected to each other by some mechanisms. So same thing can be utilized here. So even we can connect the patient pain. Whenever the patient feels pain, we ask them to imagine some mountains, rivers, all those things, and that. And there is something called physical cues. Whenever we ask the patient to visualize the happiness part of that, and we make a physical connection by doing something like this or this, repeatedly by doing, we are telling the brain that whenever you are feeling pain or down, anything, you try to do this, and that is connected to the brain, telling that subjective experience can be changed. It needs some experience to teach them, also to you to learn, but over the period of time, like example, music also, you can listen to music, particular music which heals you. That can be trained. Even the taste. So many of you or many of us, whenever we are feeling sad, we go and eat ice cream. We feel good. Because there is a soothing experience we have with the ice cream. So we want to forget the unpleasant experience. That's why we have the ice cream. So we are using NLP techniques day in, day out. But we can utilize those techniques to relieve pain also. Okay, there is something called timeline therapy or the reprocessing fast. So sometimes what I do is I'll ask the patient to stand there, suppose stand here, and imagine yourself with the pain. The same Ravi standing there without pain. So ask them, close their eyes, take to the deep state of mind, ask them to walk as if they are moving from the painful state to painless state. By walking for 5 minutes only, there is a dramatic change can occur while making this procedure. Reinterpreting pain, for example, we can tell they might be, I have an example. There was a patient, so do you have time for 1 or 2 minutes extra? Yes. There was a patient, 50-year-old man, so while explaining his pain, he told he has felt like pain, like a big rod in your back from the coccyx to the head. Then I was like doing NLP and all. I was like, okay, I'll make you down. I made him to do meditation, and he imagined the rod. Then I told, okay, imagine an elephant which is pulling you, that rod coming out. Suddenly after 10 minutes, he was feeling very good. Yeah, I was feeling. But next day he called me, sir, that elephant came back and rod kept. So this can happen, but we can definitely try. And we can do direct suggestions. So we can ask them to imagine, like as if they are sitting in a theater, imagine the pain, and it is colorful and all. So we ask them to imagine as if they are having a remote control unit. So change the color of that image, increase the speed of that, and make it black and white, or completely black out that image. So what we are doing is completely changing the representation of pain in their brain. So that we can be done by direct suggestion. So this is the present state, desired state. We ask them to imagine the present state and make them to move towards the desired state by guided meditation. Altering the sensation. So they may be feeling the burning hot feeling. In guided meditation, we can ask them to feel like as if it is a cold. So by changing this also, we can make them feel good. Or something like they are feeling the pain in the shoulder. But as you know, pain is not in the shoulder. Pain is a just representation in the brain itself. May not be in the shoulder. when we can ask in guided meditation to move that pain from the elbow, shoulder to the elbow or to the hands, moving from the painful state to the painless state. So what are the evidences? So there are few studies across the world, like effect of neuro-linguistic programming in applied to prior to uterine curettage for the fetal demise. So they got some benefits. The effects of neuro-linguistic programming in an imaginary on the pain and comfort after the open heart surgeries. So they have used the NLP techniques in the post-open heart surgery patients. So there was a RCT. So using NLP in weight management, anxiety disorders, and morning sickness, substance misuse, and claustrophobia. So they have found some benefits in these conditions. So can we use NLP in day-to-day practice? You can start from simple rapport building. As I told you, as soon as patient comes to you, the way he or she sits, the way she speaks, you can mirror that. Like imagine as if a child is sitting in front of you. Although patient is 50-year-old, his subconscious mind is of only 3 to 4 years. The way you speak to them, you have to calm down the patient, relax them, and then only the patient will trust you. The patient subconscious mind trusts you rather than the patient. So you can use the CBT techniques, but CBT technique needs an expert, and patient who comes with back pain, if you send him CBT, they will not come to back to you because patient may not feel that he needs a psychological counseling. But as a doctor, you know that he needs some psychological support. That you can give by NLP techniques. You can use CBT techniques, NLP techniques, integrated therapy, as madam told, physiotherapy, yoga, all the things. This is an adjunct therapy. I don't tell that patient coming with trigeminal neuralgia, severe pain, you use this NLP technique. No, it's not possible. But some pain things where you can use this. These are few references. Conclusion: Neuro-linguistic programming has shown promising results in managing of chronic pain. Techniques such as anchoring, reframing, dissociation have been effective in altering pain perception. NLP empowers individuals to take control of their pain, reducing the reliance on medications. It promotes holistic approach, addressing both physical symptoms, psychological well-being. More research is needed for further validate and standardize these methods. Overall, NLP could be a valuable addition to the multidisciplinary approach to chronic pain management. Thank you.